Your talk will start, right after the opening comments, but it's not going to be long. Yeah. Yeah, let me just, there's already a few coming in here, so I'm going to let them know where we're at, and then we'll go from there. But we'll be on it. We'll be on for 10. I'll let people know here too. Sure. Sounds good. Okay, talk to you then. Bye-bye.
Blake.
Good morning.
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 We've got a few participants here already. So there are some participants, and I think they can see and hear. All right, let me get right on that here for you, Teresita.
Okay.
I'm going to make you a co-host. Sorry, let's try that. How's that work?
Okay. All right, that's better. Okay. And now we'll screen share. Okay, are you seeing the screen along with, there we go. How's that?
Yeah, we can see both cartoons.
Okay, all right. Okay, I thought those were really kind of cute. Okay, so I want to, no. There we go. Okay. The topic that Blake has asked me to share some thoughts on today is the legacy of the Grey Nuns, and I'll just review the blurb that went with it. How did a handful of courageous nuns ignite healthcare in Western Canada, and how is their mission still relevant? There's a story told of a nurse sister, and I'm going to say she was a Grey Nun, who was washing the foul-smelling, ugly wounds of a patient when a man standing by said, "I would not do that for $1 million." And she said, "Nor would I." And this story, I think, says something about the dedication of Grey Nuns to continue the compassionate healing ministry of Jesus. And so just as a context for my presentation, I just want to do a bit of a reflection on that that compassionate ministry of Jesus, because what he did was so radical, so revolutionary. The culture of the day and the theology that undergirded that culture was that sickness and infirmity was a punishment for sin. And, I still run into that. Sometimes people will say, if they've been given a diagnosis of cancer, they'll say, "Why me? What did I do to deserve this?" So it's still around, that idea that there's somehow some kind of a punishment that is involved when one becomes ill or infirm or whatever, okay? And I have to confess that when I get one of my sinus headaches, I say, "Why me, Lord?" But anyway, we'll not go there right now. So, and then in addition to that, the idea of holiness was so connected with purity that to even touch someone who was sick and infirm would somehow make one a sinner. So a sinner wasn't just someone who broke a rule, but it could be anybody who got their hands dirty. Suppose they sold fruit or sold anything that would stain your hands, you were considered a sinner, okay? Because purity and holiness were so connected. So here is Jesus touching a blind man. And the question that is asked of him, now who sinned? Did he sin or his parents? And Jesus gave the answer, neither. But his blindness is to reveal God's works through him. Now that is absolutely radical. That is astounding. That is revolutionary. That instead of shunning the sick, the infirm, and our COVID experience has showed us how even in our society, we sort of shun the people who are elderly and infirm. Anyway, instead of shunning them, Jesus is saying they are special. Through them, God's compassion, God's mercy is shown, but it's through us. God depends on us to show that compassion and mercy. And so this is the foundation of Catholic health care. This is the context within which we can consider the legacy of the Grey Nuns. It's their dedication to this idea of continuing the compassionate work of Jesus, because through that compassionate, merciful care of the sick, we reveal the essence of God, the nature of God. And here's a passage that turns it around, because in this time, the non-Jews were considered to be outcasts from God's favor. They were sinners. They were enemies of God. Well, I like this passage because St. Paul, had no intention whatsoever of ministering among the Galatians. They were not Jews, they were Gentiles, and therefore they were enemies of God. They worshipped a female deity, if you will. I mean, if that isn't terrible. They had priestesses, and they were so different. They were considered strange because their ancestors had come from, guess where? Southern France. They were Gauls. And so these people were kind of fair-haired and different people. They were considered sort of country bumpkins. However, when Paul and Timothy were passing through that region of Turkey, they had just crossed the river Sanguarius, and Paul got sick, very, very sick. So all of a sudden, here was this prim and proper Pharisee who looked down on Gentiles. Now he was at their mercy. And can you imagine how squeamish he would have been, because he was also one who was big on purity at this point. He was very narrow-minded. This was at the beginning of his ministry. He was being touched by women, by pagan women. I mean, we can imagine that the Galatian women would have been the ones looking after him. Many years later, he wrote to them, and I think this is a statement of what I have connected with the legacy of the Grey Nuns. When Paul wrote to the Galatians, he says, "You know that it was because of a physical infirmity that I first announced the gospel to you. Though my condition put you to the test, you did not scorn or despise me." Now, scholars have wondered, what on earth was that condition? We don't know, but some believe that he was there up to a year, so it must have been pretty bad, okay? "But you welcomed me as an angel of God, as Christ Jesus." Wow, these pagan Galatian women who would be considered enemies of God welcomed him as an angel of God, as Christ Jesus. "I testify that had it been possible, you would have torn out your eyes and given them to me." What a magnificent gesture or statement of praise for people in healthcare. And this is the other side of it. It's the enemies of God treating this holy man, this so-called holy Pharisee Jew, member of the chosen race. Okay, so we move now to the story of Saint Marguerite Juville. Marguerite Juville, this is her maiden name there, was born on October the 15th, 1701 at Varennes, Quebec, daughter of a prominent family. I have printed her story to make a point. In the print on the right, you will see something positive, but when I print something in italics, there is a disaster, a calamity, it's a tragedy, and this is what shaped her spirituality of confidence in divine providence. She had one very, very rough life. But whenever she had a blessing, now she came from a prominent family, so that would be a blessing, there would be a tragedy. And so she was 7 years old when they lost her father, who was a captain, by the way, in the army of Louis XV. So he would have received a fairly good salary, and the family was respected in a very prominent family. Suddenly, they were destitute. 6 kids, the mother, they were all destitute. However, here's a positive. A wealthy relative paid for her to attend the Ursuline monastery school in Quebec for 2 years. Now, when you think in those days, girls, or most people, not just girls, did not get an education, she was sent to a very famous monastery for girls in Quebec. And this was a huge, huge blessing for her. Okay, after 2 years, she returned back to her home, helped her impoverished mother, raised the rest of the family. By the way, Marguerite was the oldest. However, her mother remarried, and she happened to marry a doctor who was a very, very violent and explosive man, okay? Very unpredictable. It was terrible, okay? When she was 18, she fell in love with a very respectable young man, and they became engaged. However, because of her mother's remarriage to this disreputable guy, her fiance's family rejected her, and she was absolutely heartbroken. So at the age of 20, she married Francois Duville, not knowing that he was a gambler and a bootlegger, and he was terrible. However, they had 6 children in 7 years, but 4 of her children died in infancy. I mean, just look at the ups and downs that she went through. And then her husband died. I didn't know whether to put that as an up or a down, but anyway, when he died, she was left with his crushing debts. He was a gambler. So she had to work and work and work to try to repay those debts while she was raising her 2 sons. However, it was during this very dark time in her life that she had a profound religious experience, an experience of God's love for her personally. And it was this experience that anchored her in a profound trust in God's providence. I believe that Marguerite's life is really a key to the legacy of the Grey Nuns. So she then took in, she had these 3 associates, and they dedicated themselves to Mary and began to take in the poor and sick and disabled people of Montreal. However, because of the bad reputation of her now deceased husband, the townspeople threw stones at them and called them the Les Sœurs Grises, which means the tipsy nuns. They thought they were drinking and gambling and whatever else was going on in there. And even the priest denied them communion. And then on the night of January 31st, 1745, their home burned to the ground. Well, 2 days later, this group made this original commitment. For the greater glory of God, for the relief of the poor, we are united in charity to live and die together, to consecrate without reserve our time, our days, indeed our entire life, to labor, to receive, feed, and support as many poor as we can take care of. And that commitment has been signed by every Grey Nun since that day. It's almost unbelievable that in the worst of circumstances that you can almost imagine, they made this promise that for the rest of their lives, they would, without reserve, take care of the poor. Meanwhile, her two sons became priests. The older son, Francois, was a great heartache for her. He didn't seem to be able to handle money very well. And of course, she was very, very poor. But at some point, he was so badly in need of money, he borrowed money from her. I don't know how much, but I think it was a fair amount, and promised to pay back. But when he didn't pay it back and didn't pay it back, she decided to take him to court. However, he suffered some sort of accident and broke his arm. So she took him in, took care of him, healed his arm, but took him to court anyway to get her money back. Okay, so things were not too harmonious between herself and her older son. Charles, however, was different. He was a very, very supportive of his mother. However, during the battle between the English and the French, he was imprisoned by the English. There's a whole story there that I won't be able to go into. I think he was there for 6 months or so and somehow managed to escape. But Charles was always very, very supportive of his mother, even while Francois was a great heartache to her. So she was a mother, but she had to worry about her two boys, as any mother would worry about her sons. Okay, after the fire of that original home, she was assigned to run the General Hospital of Montreal, which was in a deplorable condition. And actually, it had been abandoned by the brothers who had been running it. And it became more like a poorhouse where people came for help. And they looked after the elderly and the sick and the poor, the prostitutes and orphans and mentally ill and disabled and abandoned infants. Meanwhile, the bishop opposed their work. You know, she didn't get support from the authorities, the clerical authorities. She always got support from the Sulpician fathers who ran the seminary. Thank goodness. And she befriended one of them who was her spiritual director for about 25 years. And thank goodness he was there to support her. But the bishop opposed their work and he wanted to merge this hospital with the Quebec hospital. There's a whole other story there that had to do with finances and legalities and so on. Okay, in 1753, after many obstacles and hardships, this group was recognized by King Louis XV of France as a new institute, the Sisters of Charity, Grey Nuns. It took 2 years for this bishop to give canonical approval. And then at that point, the sisters themselves started to wear a uniform made of gray material because they had been ridiculed as les sœurs grises, okay? So there you have Mother Marguerite taking an insult and turning it into a badge of honor. And then 2 years later, the institute was officially recognized. I'm not sure, but I suspect it would have been by Rome. Okay, then in 1763, the hospital burned to the ground. And as they stood before the smoking ruins, she gathered everyone around her and said, "We are going to recite the Te Deum on our knees to thank God for the cross he has just sent us." 118 persons were left homeless by the fire. They were given lodging by other sisters, and the Sulpician priests, the sisters, and the native people who remembered her care during the smallpox epidemic of 1755, and many others, helped to rebuild the hospital. She was now 64 years old. She directed the rebuilding of the Montreal General Hospital, and it came to house 170 dependents, looked after by her 17 sisters and lay helpers. 6 years later, worn out by her selfless labors, she suffered a stroke and died on December 23rd at the age of 70. At the moment of her death, a luminous cross appeared over the General Hospital, and we have an image of it there. The life of Marguerite shows us how it is that the Grey Nuns could be so courageous, take such huge risks, suffer incredible hardships, and always trust in the providence of God. And it's because they were daughters of Marguerite Juville. And when we see her life, we see how the Grey Nuns have a model for their ministry. Okay, she was beatified by Pope John the 23rd and then canonized by Pope John the 2nd. And she's the first native-born Canadian. There are other Canadian saints, but they were born elsewhere, like Saint Marie of the Incarnation and Ursuline was born in France, and Marguerite Bourgeois was born in France, and Lavelle. But Marguerite Juville was born here in Montreal. All right, then I just thought I would just point out that Canada Post issued a postage stamp in her honor in 1978, and they chose to depict an event that happened during the famine of 1759, when there was absolutely nothing to eat in the General Hospital, 170 people and nothing to eat, and suddenly there appeared these barrels of flour from which they were able to make bread. And so this was depicted by Canada Post. Okay. Now we move into the story of the Grey Nuns. I'm going to have to talk a little faster here. The first sisters to come to Western Canada were 4 Grey Nuns who made this trip in birch bark canoes, if you will, from Lachine to St. Boniface. And these 4 sisters were not medical people. They were teachers, because Provençal wanted to have teachers to teach the girls in the Red River settlement. However, when they came there, even though they were not medically trained people at all, they began to take care of the sick. And they were visiting the sick as well as educating the girls. And within those first 11 years, they made more than 6,000 home visits. Now, there's a story of a visiting sister, Sister Therese was her name, who was posted there temporarily, and she apparently had some medical skills, and they began to call her Dr. Sister. But she was recalled to, I believe it was Ottawa, and the Métis people kidnapped her because they didn't want her to leave. And that's when they opened the St. Boniface General Hospital. She was given permission to stay, and she became the first administrator of the hospital. And there you have a picture of it. This is the first hospital in Western Canada. It had 4 beds, and it had a kidnapped administrator as the one who ran the hospital. I think it's a wonderful story. Okay. And now we come to, there we go. No, come on. The first sisters to come to Saskatchewan were also Grey Nuns, and they started out on June the 4th from Montreal, went by train to Minneapolis, St. Paul, a trip that took them 5 days. And then from Minneapolis, St. Paul, they were taken by an ox cart caravan. Remember, there were no roads, and there are lots and lots of lakes in Minnesota. And so they had numerous portages, and they had these men to actually sometimes had to carry them across the streams and rivers and so on. Let me see, they would travel in a caravan of 13 ox carts, 800 kilometers, okay? And Bishop Grandin was with them. So it was Bishop Grandin and the 2 Grey Nuns from Montreal in their 20s. And it's hard to imagine what that would have been like, because in both of these trips that I've just mentioned, they'd have slept outdoors unless they had to sleep under their canoes. And these were young women in their 20s traveling with voyageurs who knew these routes, and they probably weren't the most refined of men. So I can hardly imagine the trip. Then at St. Boniface, a 3rd Grey Nun joined them, and a volunteer woman. So now they were 4 nuns and 1 woman. And they set out for La Crosse, and it was a distance of 1,700 kilometers, and they arrived 67 days later. After 37 portages, scorching heat, hordes of mosquitoes, lightning storms, rain, snow, cold, and nights under a tent. At one point, they were abandoned by the guides, and they thought they would freeze to death in a remote island where they didn't even know where they were. Okay, 2 days after their arrival, on October the 4th, 1860, at the La Crosse, a 9-year-old sick boy was brought to their house. So he was the very first patient in the very first Grey Nuns hospital in Saskatchewan, the very first of 45 hospitals in our province in which sisters of various orders would serve eventually, okay? 9 of these owned and operated by Grey Nuns, and 11 of more of these were nursing homes. And eventually, I think it comes to some 45 hospitals, if you include the public hospitals that some sisters served in. A few days later, 2 orphans were admitted. So we could call that the first of 43 boarding schools that the sisters of various orders would eventually operate. By the way, we've had representatives from 62 different religious orders serving in Saskatchewan, totaling something like 6,000 sister years of service. Okay, enough of statistics for now. And then a few days after that, Sister Marie Ann Pepin, the one they had recruited from St. Boniface, who was a teacher, she started teaching 15 student boarders in a room, which also served as the dormitory, a dining room, recreation room, a classroom. And this was to become the first of some 280 Catholic schools, or public and Catholic schools, half of them were public, half Catholic, in the province. So that's how we begin the story of sisters in Saskatchewan, and particularly Grey Nuns, who owned and operated 9 hospitals. And okay, they traveled by ox cart, so that would have been quite an experience, okay? And here we have those first Grey Nuns visiting the native people, administering a smallpox vaccine to hundreds of native people there, okay? And I want to move my screen. There we go. Okay, now we're going to focus for a little bit on St. Paul's Hospital in, I thought I had one before here. Just a second, there's something wrong here. No, I want to go back. There we go. These are the hospitals that were founded by Grey Nuns in Saskatchewan. St. Joseph's Hospital in La Crosse was the first, and I have dates there because the sisters were away for a while, but they came back. And the dates that I show there are the dates that the Grey Nuns left those hospitals. They're not necessarily the dates that the hospitals closed, although I think that is the case for Rosthern, okay? But anyway, we could spend time looking at these, but I just wanted to give you a sense of the hospitals that were owned and operated by the Grey Nuns. Somebody wants to ask a question. Blake, how do we handle that?
I'll take care of the chat room there. I'll lower that down.
Okay, so I can continue?
Thank you.
I can continue? Okay. All right. Now, the story of St. Paul's Hospital opening is quite different from the story of the Regina Grey Nuns Hospital opening. The Regina Grey Nuns planned the opening, or I should say the Grey Nuns planned the opening of the Regina Hospital, and actually recruited and commissioned 2 sisters to go there, and it was done in a kind of an orderly way, if I can say that. I'll come back to that later, but not so here in St. Paul, not in Saskatoon. There were 2 sisters coming from St. Boniface, and they were actually on a mission, collecting money for their hospital in St. Boniface. You could see that that little hospital, well, later on it was expanded to 10 beds. But anyway, you could see that they wanted to build that, build a bigger hospital in St. Boniface. So when they came through Saskatoon, they knocked at the door of the rectory to find out what time Sunday Mass was. And meanwhile, there was a typhoid outbreak here in Saskatoon, and these two oblate priests had 7 men sick with typhoid in the rectory, and they were praying for help. So when there was a knock at the door and 2 Grey Nuns showed up, thinking they were just coming to ask a question about Mass, the 2 oblates thought, wow, this is an answer to prayer. And they asked the 2 sisters to look after these men. So the sisters somehow, I think, sent a telegram back to St. Boniface for permission to remain in Saskatoon, which they did. This is a fascinating story. Sorry, I don't have time to tell all the details, but the long and short of it is that eventually they were so respected. They did such a wonderful job of decorating the church for Christmas Eve Mass that the people from Saskatoon sent a delegation to Montreal and asked the sisters to send somebody to open a hospital in Saskatoon. And the 2 sisters that were sent were Sister Fanav and Sister Dosity, Saint Dosity. They were the first. Okay, Sister Fanav was the foundress, and Sister Saint Dosity, first superior administrator. Okay, and the Dr. Willoughby opened up his home, and an extension was built. And so this is the way it looked in 1907. It was the largest hospital in Saskatchewan with 45 beds. The story of the sisters' work here in Saskatoon is probably this, similar to stories elsewhere, but I'll just focus on it for a bit. They did get an X-ray machine, and during the Spanish flu of 1918, they were absolutely overwhelmed with patients. And again, they suffered persecution. The history book simply says that there was some really bad press given about the sisters at St. Paul's Hospital. It went all the way to Winnipeg. Their reputation was defamed, but it doesn't say what was said about them. And I would like to know what exactly was the mud that was thrown at them. But in any case, the sisters just kept on working through this. And certainly during the Spanish flu, they worked, and they were so poor. They didn't have running water, so they had to carry chamber pails. And they had to melt snow for water so they could do the laundry. And they worked around the clock, and every spare minute they would be knitting so that they could sell some of their knitting so to make a little bit of money for the hospital. Anyway, the hardships are just unbelievable. They opened a school of nursing, and this is something that the Grey Nuns did very, very quickly when they opened a hospital. They opened several schools of nursing there. You have the class of 1916. And here we have the new hospital that was built in 1925. And then the Depression struck, and you had utter poverty, the dust storms, people couldn't pay, and they would pay with produce or with chickens or whatever. And this story is repeated at Gravelburg, for example. And at one point, the St. Paul's Hospital was almost closed because they thought they just would not be able to manage. Anyway, they carried on valiantly. And I think this is a marvelous photo of the nurses. And eventually, 2,057 nurses graduated from St. Paul's of Nursing, School of Nursing, which ran from 1909 to 1968, when it was taken over by the university. And here you have just an absolutely stunning photo of the graduating class. And I want to show this coat of arms, us shall be perfect even in little things. I live here at Trinity Manor, and we have several women here who are graduates of St. Paul's School of Nursing. And I have a cousin who is a graduate of the Regina Grey Nuns. And they said, yes, indeed, I shall be perfect even in little things. The standards were very, very high. The way they made the beds up and every little thing, the Grey Nuns were very, very demanding. They were perfectionists. And this was their motto. And it was only not late, last night, when I discovered that the motto was actually done up by one of our sisters, Sister Vincencia, who was an Ursuline prelate, designed by Father Mulcahy and done up by one of the sisters that I knew really quite well. That was a discovery last night. But my point was not that, it was to show the high standards that the sisters, the Grey Nuns, had in training those nurses. Another point I want to show out about the Grey Nuns is how they always, always, always brought forth the leadership skills of the wider community. They worked with doctors and nurses. During the Second World War, for example, they took in Jewish doctors who were refugees, and they asked no questions about the religion of their patients or their doctors or the nurses. They were so open to anyone and everyone. And when Dr. Buchwald, Alvin Buchwald, died, they went to the synagogue for his funeral. I mean, they were just so broad-minded and so open. They worked with instructors and administrators, and they had auxiliary associations and support staff. They worked with politicians and civic officials and with church leaders. So they certainly were not, sisters that were cloistered in any sense, but they were certainly collaborators. And that's why they were able to hand over their hospitals and trust that their hospitals would continue in the spirit of St. Marguerite and the Grey Nuns. Okay, just a quick note back to the Regina Grey Nuns, just to show again how dedicated the Grey Nuns were. Sister Mary Duffin was actually an American. She had come up from, I believe, North Dakota, and they purchased the Park Sanatorium on Angus Street, and they opened up the School of Nursing immediately. Excuse me. And their story is sort of more methodical. However, they also suffered many of the same hardships and self-sacrifice. During the war in Saskatchewan again, the St. Paul's Hospital was filled to overflowing with soldiers. They had to take in the soldiers and look after the soldiers. And by the way, back to Montreal, when the French and English were fighting, when the English soldiers were wounded, guess where they were brought? They were brought to the Montreal General Hospital, where this Grey Nuns would look after the English soldiers who were the enemy, as well as the French soldiers. Very interesting. So there we have some of the facts over the history of the Grey Nuns Hospital. I want to give a nod to more hospitals than just the St. Paul's, but I don't have time to go into the stories of all 9 of these hospitals. And then St. Paul's Hospital, as we all know, was transferred to the Bishops of Saskatchewan through the Saskatchewan Catholic Health Corporation. So for 92 years, from 1907 to 1999, with shaky start, very rocky start, almost closed down, many times run off their feet during the polio epidemic, and on and on. There were many crises. They continued to operate. And during those 92 years, there were 276 Grey Nuns who had served at St. Paul's Hospital, accumulating 1,375 years of care with a difference. I have a directory of all the names of all the Grey Nuns, well, all the sisters, almost all 6,000 sisters that ever served in the province, and the number of years they served. So I was able to calculate the number of sister years that they have total here in Saskatchewan. The Grey Nuns alone, since those first sisters arrived in Île-à-la-Crosse, some 900 Grey Nuns have served in Saskatchewan, totaling over 7,200 sister years of service. And time is moving on, and I'm going to move on to, okay. Okay, what's their legacy? Well, I've spoken at some length, I think, about their spiritual legacy. That original commitment that they made to care for all the poor and needy in as much as they're able to, in the spirit of compassion and mercy that is part of the gospel of Jesus. And here are, this is a very concrete, pardon the pun, legacy, where we have 9 hospitals. I'm sorry, I have pictures here of these hospitals at different stages. So some of these would be looking quite different than they are here. But anyway, just to give you an idea of the buildings that are here as very, very concrete tributes to the Grey Nuns. All of these were founded by the Grey Nuns. Okay, I'm just going to do a quick review of Western Canada. Here are the hospitals that were founded by the Grey Nuns in Manitoba. The St. Boniface General Hospital, huge, huge hospital. The St. Roch Hospital, which was open for people with contagious diseases. Taché Hospice, the Sanatorium, which is now the St. Amant Center for children with disabilities, the Sarah Riel Mental Health Clinic, and the St. Rose de Lac Hospital. And in addition to hospitals, the Grey Nuns operated therapy centers and clinics and shelters and on and on. Here we have the hospitals that they founded in Alberta. Holy Cross Hospital in Calgary, and there's a very, very stunning monument outside the Holy Cross Hospital. Remember when I was taking a walk one day when I was doing a retreat, giving a retreat at the retreat center there, I just came across this stunning monument, and then I realized that this had been the Holy Cross Hospital of Calgary. Beautiful. And then I have listed there the other hospitals, and well, I guess the only one that is still that still has Grey Nuns present is the Youville home in St. Albert. I think the sisters have left all the others. In addition to that, I couldn't begin to go into the stories of these 19 missions in the Northwest Territories, but I thought it would be just helpful for us to realize that the Grey Nuns were almost everywhere. As far as I can tell, they weren't in BC, but look at all the missions they opened. And again, it's a combination of residential schools, which for many is now, cause of shame, but an embarrassment. But I'm going to leave that for now. But a lot of these were clinics and health centers and hospitals and on in the Northwest Territories, all the way up to Tuktoyaktuk and Inuvik and Aklavik and so on. Incredible stories of self-sacrifice and dedication. Okay, so what's their legacy? I think it falls into roughly 3 categories. One is the attitude toward nursing, but the spirit of healthcare that the nurses, that the Grey Nuns brought. I'm going to share a personal story here. 40 years ago, I had surgery in St. Paul's Hospital here in Saskatoon. It was a cancer scare, but it turned out to be benign. But there was this one day when I was having a lot of pain. And I remember a Grey Nun came to my room. It was about twilight. And I believe her name was Sister Laramie. And she came into my room, and she was such a calm, peaceful presence. And she spoke to me very gently, very tenderly. I can't remember what she said. And she didn't even stay long. But the quality of her presence was such that it relieved my physical pain. After she left, I'm going to become a little emotional because 40 years later, I can still feel that she brought with her, there was some kind of a healing presence. I don't think she touched me or anything, but there was just something about her way of being at my bedside that is unforgettable. And there was something there that I don't have the language to explain. This is something else that I want to spend some time on. These sisters not only left us buildings and a spirit, but they left us systems, organizations, and I'm going to highlight 3 of them who did astounding work by being bold and creative in creating organizations. The first of these is Mother Virginia Allaire, okay? And I'm just going to read the text because if I just, I'll get off into too many tangents because it's such an interesting story. In 1942, when the government refused to negotiate with the Catholic hospitals because they were part of an international organization. See, at this time, there was the Catholic Hospital Association in the United States and Canada. And the president was a Jesuit from St. Louis, Missouri, Father Schwetalo, who was considered one of the 5 top professors of medicine in all of the United States. And he was the president for over 19 years. And he had come to Winnipeg to a meeting, and he had warned the Catholic hospitals, the doctors and nurses in Canada, had warned sternly against any kind of government interference in Catholic healthcare because they would lose everything. And the history book that was done by Szilard says that one of the doctors said one of the Mother Superiors who was sitting beside him leaned toward him and said, "I don't believe a word he is saying." Unfortunately, it doesn't say who the Mother Superior was. I'd like to know if it was a Grey Nun. Anyway, it was a Grey Nun then who at the same organization in Toronto in 1942, at which Father Schwetalo, the president, was there, she stood up and proposed that they break from this international organization and create the Catholic Hospital Council of Canada. And this meant a complete separation from the Catholic Health Association of the United States and Canada. So she dared to do this, Mother Virginia Allaire. She served for 4 years at Grey Nuns in Regina, but as far as I could tell, that's the only time that she was in Saskatchewan. Well, in 1943, with the specter of socialism, and that's a quote from Father Schwetala, these 2 sisters, Mother Doré from Montreal and Mother Allaire, went to the 3 prairie provinces and hastily organized 3 provincial associations of Catholic hospitals. The first one was in Alberta, February the 9th, 1943. The second one was in Manitoba, March 15th, 1943. No date was given for when the Saskatchewan one was organized, but I suspect it was shortly thereafter, possibly in April of 1943. And the Catholic Health Association that you and I are part of right at this moment is based on the work of these 2 Grey Nuns who hastily organized provincial associations of Catholic hospitals to serve as their official voices in negotiations with the provincial government. Then there's Sister Jean Mandan. She was a director at St. Paul's Hospital. By the way, she was born in Titanic, Saskatchewan. I had never heard of Titanic, Saskatchewan. It is somewhere in the Duck Lake area. Anyway, when the Catholic Health Conference of Saskatchewan was formed, she became its president back in, I guess, would have been 1943. At that time, Catholic hospitals were provided more than half of the hospital beds in the province were entirely dependent for their survival on the generosity of Catholic sisterhoods. Now, Sister Mandan somehow persuaded Bishop Philip Pocock to go to Regina to meet with Premier Douglas, who did not want to up the contributions to Catholic hospitals. The story is told that Premier Douglas said, "I thought the sisters made a vow of poverty," whereupon either Pocock or Mandan said, "But our vow of poverty is made to God, not the CCF government." Anyway, Sister Mandan created a committee that worked out a very detailed point system with regard to the sisters' contributed services and presented this plan to Bishop Pocock, and then they went to Premier Douglas and they came back. The mission was accomplished. The bishop was able to announce that agreement had been reached, but it was Sister Mandan who did the work. But anyway, he was the one who announced an agreement had been reached. And furthermore, at that same meeting, Premier Douglas approved a $1 million extension to the hospital in North Battleford. So there we have Sister Jean Mandan. And finally, Sister Bertha Doré, marvelous, marvelous woman. She was the president of the Catholic Hospital Association of Canada. And when they had their meeting here at the hotel in downtown in 1957, there was a lot of arguing going on about this proposed government hospital insurance plan. So she finally, I guess, had her gavel. I'm making that up now. Did she have a gavel? I don't know. She said, enough arguing. Now we get to work. Roll up our sleeves and get to work and develop the principles of cooperation between Catholic hospitals in Canada. This was a national convention and a national hospital insurance plan. So they hammered out the general principles for a national hospital insurance plan. Then they took that plan upstairs to the next floor where the Minister of Health, Honorable Paul Martin, was waiting for something to take back to Ottawa. If I live long enough, I would like to see if what the federal government passed in 1962 as the National Hospital Insurance Plan, which we now call Medicare, was close to what Sister Doré had the Catholic Hospital Association of Canada create here in Saskatoon in 1957. If that would be the case, then along with T.C. Douglas, who is called the father of Medicare, I would think that Sister or Mother Doré, as she's called because she was a superior in Montreal, should be called the mother of Medicare in Canada. Okay, I'm going to wrap it up now. The spiritual legacy of Saint Marguerite, her mission lives on today. So how is it relevant today? All the doctors, nurses, caregivers in our Catholic healthcare facilities in Saskatchewan are standing on the shoulders of the Grey Nuns. Yes, there were many other sisters, and I want to give credit to the Sisters of St. Joseph, the Daughters of Wisdom, the Sisters of Providence, of Kingston, and on and on. But the spirit of Marguerite Deville and the Grey Nuns is alive in all our Catholic healthcare facilities today. Her mission lives on today in those who, like her, show the compassionate love of God and ministry to the poor, not only the materially poor, but those who are poor in body, mind, or spirit. Marguerite saw her journey through life. We saw the ups and downs, the tragedies, and then the blessings. She saw that as a series of opportunities to respond with love and compassion to all. She sought God in the simplicity of her heart and found Jesus in the poor whom she served. By her works and actions, she became a bearer of the good news. She was given the title of Mother of Universal Charity at her beatification in 1959, and this is taken from a pamphlet called A Journey of Love, written by these two Grey Nuns. I want to close on a light note, and I don't know why. There we go. The name Marguerite is also the name for a flower, a daisy. And one of the books that I have sitting on my desk now compares Marguerite as a daisy, a pearl of great value for all the needy people of the world. And this is how I'm going to close. Daisy is a simple plant, thriving in any flower garden or flower pot. The Grey Nuns try to live a simple life, to be happy where they are planted, and to be ready to be of service to those in need with a welcoming smile, a caring heart, a helping hand, a listening ear, and a word of hope. They are the heart, the hands, the feet, and the eyes of Jesus, the compassionate healer. And with that, I thank you for your kind attention and turn the attention back to you, Blake. Thank you for this opportunity to share. Bye now.
Thank you very much, Teresita. Really appreciate that. Very interesting as always. I could listen to you all day. Appreciate the history of just the hardships and the travel, the ox cart, the birch bark, really tying it into the development of Canada, but also developing the reality of the life of a saint, whether it's the hardships or the suing her own son, but the strength of character of those early women really came through. One of the things that struck me was you talked about the luminous cross that appeared over the place where she had died. There was one day I was walking into St. Paul's coming in through the sea wing doors, and I don't know if a lot of people have seen it, but there's a cross way up at the top of the building, cut into the building, and then there's a bunch of light bulbs in it. And if you go there on mornings where it's a crisp day, where there's fog in the air or ice crystals, you'll see a cross kind of shining out on that side. So that kind of struck me there. Again, just the history of the sister hours, as you call them, the 7,200 sister years of service, the meticulous way you went through the history and the photographs. I know you're an Ursuline, but you know, with the perfection of it, you could have been a Grey Nun as well. So the photos and maps, I really appreciate that too, because that really grounds, makes real that these aren't just, you know, sort of some historical figment, that these are people who traveled through this territory, who knew Saskatoon and planted these hospitals where they needed them. So that was beautiful. Again, I like the way when you're talking about sharing the information, you really focus on those relationships, those connections, that this didn't, again, you know, just happen by luck. These women worked with the powers that be. They worked with the city, they worked with the province, they worked at a national level to develop the system of Catholic healthcare that we have in Canada. So again, you've proven today that you're a lifelong teacher because you're also a lifelong learner. So I very much appreciate your time here. We have just a few comments here. Great presentation. Thank you, Sister Teresita. We can never have enough gratitude for the work and the service of the Grey Nuns. Very, very true. Very interesting, fascinating. Lots of good comments and kudos. So thank you very much, Teresita. I'll also note, folks, we have our next presentation, Megan Engel, coming up at 2 p.m. So it's the same link. So hopefully we'll see some of you there. But again, God bless. Have a very good day out there and all the good, beautiful work you're doing. And we'll talk to you soon. Thank you.